In healthcare, trust between the patient and the nurse is essential. But what happens when a patient refuses care from a student nurse who is still learning? Good day, everyone. We are Group 4A from BSN 3D. I am Desiree Tabiolo, and together with me are my group mates Christine Pizarro, Leonard Polverido, Matt Senyares, and Luis Trebel, and we will be presenting our research entitled Factors Associated with Client Refusal of Nursing Care by Student Nurses During Clinical Rotations. Clinical training is an essential component of nursing education because it allows students to apply theoretical knowledge into real patient care. However, one challenge that student nurses encounter during clinical rotations is client refusal of nursing care. This situation may limit students' opportunities to perform procedures, fulfill clinical requirements, and gain confidence in their professional roles. Therefore, this study aimed to determine the factors associated with client refusal of nursing care by student nurses during clinical rotations.
First, for the purpose of the study. This study aimed to determine the factors associated with client refusal of nursing care by student nurses during clinical rotations. Understanding these factors is important because refusal of care may limit the opportunities of student nurses to perform procedures, develop clinical competence, and build confidence in patient care.
Next is the research design. The study used a quantitative descriptive correlational research design. The descriptive method was used to determine the occurrence of line refusal of nursing care and the perceived factors contributing to it. Meanwhile, the correlational approach was used to examine the relationship between the identified factors and the demographic profile of student nurses.
For the study sample, the respondents of the study were 249 student nurses from Level 2, Level 3, and Level 4 who had clinical exposure. These participants were selected using random sampling to ensure that respondents had relevant clinical experiences related to the study. Next is instrument used in the study. The researchers utilized a modified standardized questionnaire. The instrument was adapted from the study of Mary Idaho Edward and Tabo. The original instrument measured patients' perceptions towards the involvement of nursing students in their care. For this study, the questionnaire was modified to reflect the perspective of student nurses regarding client refusal of nursing care. The instrument consisted of 12 items covering factors related to client refusal of nursing care. A 4-point Likert scale was used, ranging from strongly agree to strongly disagree. To ensure reliability, the instrument underwent pilot testing and obtained a Prong Bash alpha of 0.797, indicating acceptable reliability.
Next, let us proceed with the results of the study, starting with the participants' profile. Table 1 presents the respondents' demographics in terms of age, sex, and year level, with a total of 249 student nurses. In terms of age, most were 21 years old and below, or 75.9%, indicating they are in the early stage of clinical exposure. In terms of sex, the majority were female, or 66.3%, reflecting the predominance of women in nursing. In terms of year level, most were Level 2 students, or 39.4%, followed by Level 3, or 33.7%, and lastly, Level 4, with 26.9%.
Next, let us discuss the occurrence of client refusal of nursing care experienced by student nurses during their clinical rotations, including the frequency, year level, and clinical area where it occurred. The findings show that most respondents experienced client refusal only 1 to 2 times, indicating that refusal is not a common occurrence among student nurses. In terms of year level, refusal was most commonly experienced during the second year of clinical exposure, when students are still developing their clinical skills and confidence. With regard to the clinical area, client refusal was most frequently encountered in the outpatient department and general ward settings where patient interactions are more frequent. Next, for the perceived factors contributing to client refusal of nursing care, the results show that the overall influence of these factors was interpreted as low, with a composite mean of 2.27. This indicates that the identified factors generally have minimal influence on client refusal of nursing care. Among the factors examined, communication-related behaviors and proportional appearance and demeanor were observed to have relatively higher influence compared to the other factors. These findings suggest that patients may be more sensitive to how student nurses communicate, interact, and present themselves when providing nursing care. Overall, the results highlight the importance of effective communication and proportional appearance and demeanor in promoting patient acceptance of care provided by student nurses.
For Table 4's results, let's discuss how student nurses' perceptions of factors contributing to client refusal of care relate to their demographics. For communication skills, age did not have a significant effect, but differences were seen across sex and year level. This suggests that male and female students, as well as students at different stages of training, perceive communication differently, likely due to varying clinical exposure and confidence. For professional appearance and demeanor, all demographic variables, including age, sex, and year level, were significant. This indicates that perceptions of professionalism vary depending on students' backgrounds and level of training. In contrast, previous experiences with student nurses and institutional or environmental factors showed no significant differences across any demographic groups. Overall, while communication and professional appearance vary by student characteristics, other factors are perceived similarly, highlighting both individual differences and shared clinical experiences.
In conclusion, this study explored factors associated with client refusal of nursing care among student nurses and how these relate to their demographics. Most respondents were young, female, and in the early stages of clinical training, and client refusal was reported as infrequent. Overall, most factors like prior experiences, institutional policies, and general communication skills were perceived to have minimal impact. However, professional appearance, demeanor, and specific communication behaviors were more influential. These factors also show significant relationships with sex and year level. This highlights that interpersonal behavior and professional presentation plays a key role in patient acceptance, emphasizing the importance of communication skills and professionalism in clinical practice.
Finally, for the recommendations. Universities are encouraged to strengthen communication and professionalism training before clinical exposure. Nursing educators should implement simulation activities, role-playing, and guided patient interactions to help students improve their communication and interpersonal skills. Student nurses are also encouraged to develop confidence, communication skills, and professional behavior when interacting with patients. Lastly, future researchers may explore patients' perspectives and other factors influencing client refusal of nursing care.